Hello, my name is Ananya Anand, and I'm a surgical resident and current surgical education fellow at Stanford University. And I'm presenting on our review paper, We Need to Do Better, a call for evidence-based wellness programs in surgery residency. There's extensive evidence describing high rates of burnout, depression, and fatigue among surgical residents. Some wellness policies, for example, duty hours, are codified for all residencies. However, the burden is often on individual residency programs to develop specific wellness programming. Questions remain as to the quality and effectiveness of these individual wellness programs, despite pervasive issues around wellness and calls for strategies to improve resident well-being. So given the lack of evidence-based structure and guidelines for wellness program development, and the question of whether current wellness programs are truly beneficial, we designed a scoping review to address the following questions. 1, what are the published wellness initiatives used in surgery residency programs? 2, which domains of wellness do these programs address? And 3, how are outcomes from these programs evaluated? We performed a preliminary literature search to identify key concepts and index terms, which included wellness, surgery, initiative, and residency. 2 reviewers screened all abstracts and full text for inclusion. Inclusion criteria included English language wellness programs targeted toward residents in U.S. surgical and surgical subspecialty residencies. 51 studies were included in final analysis, representing 39 distinct wellness programs. The 2 key conceptual frameworks that guided data extraction were Kirkpatrick's model of program evaluation and the domains of wellness as described by Williams-Karneski in 2020. These include physical, social, emotional, spiritual, occupational, financial, and intellectual domains. In addition, medical education research study quality instrument, or MERSCI scores, were calculated for each study to determine study quality. The 39 programs included 30 from surgery or general surgery, 5 from otolaryngology, 3 from neurosurgery, and 1 from orthopedics. The most common domains of wellness addressed were emotional, occupational, and physical, while the least represented by the programs were spiritual, financial, and intellectual. The Kirkpatrick model is a well-known conceptual framework used to help guide program evaluation in medical education and describes 4 levels. Level 1, reaction, level 2, learning, level 3, behavior, and level 4, results. Addressing higher levels is more difficult and time-intensive, but also provides more valuable information that generates richer program evaluation and a greater understanding of program impact. Of the 51 individual studies included in this review, 8 did not conduct any program evaluation, representing about 16% of studies. A total of 27 studies evaluated level 1 outcomes, 30 evaluated level 2, 3 evaluated level 3, and none evaluated level 4 outcomes. 33 out of 39 programs, representing 85% of programs, did not have any kind of follow-up studies. However, some of these programs did collect data over multiple years. The mean MERSCI score was 9.16, much lower than the maximum possible score of 18. Of note, more than 10% of the studies included in this review were not able to be scored because they lacked an intervention and/or program evaluation with subjective or objective outcomes, and therefore could not be considered original research as described in the original MERSCI paper. All of these results together suggest that there are concerns not only with how wellness programs are designed, but also with how they are evaluated and studied. To the best of our knowledge, this is the most comprehensive review of published wellness programs and initiatives in surgical residency, and the only review of published surgical wellness programs that evaluates outcomes using Kirkpatrick levels and quality using MERSCI scores. This review reveals a major gap in the evaluation and quality of surgical wellness programs in the literature. Published wellness interventions in surgical residency are rare, with even fewer incorporating programmatic evaluation at the level of behavior and results change. Most programs have not been evaluated longitudinally, so long-term benefits for residents is unclear. This creates a major challenge in understanding the true value and impact of these programs, which is essential in order to better ascertain their effectiveness. This is critical when considering how we allocate time, finances, and resources toward programming that is impactful in the long term for residents, as well as for the residency program, patients, and the medical system as a whole. Overall, our review calls for evidence-based and data-driven wellness interventions. Rigorous and deliberate efforts that address multiple wellness domains and utilize more robust evaluation methods are required to achieve effective wellness programming. Thank you.